You're listening to the Hoof Care Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Mark Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 19, The Frog and its Associated Pathologies.
Introduction.
The frog is a highly specialised and often underappreciated structure within the equine hoof. Despite its relatively small size compared to the overall hoof capsule, it plays a central role in locomotion, shock absorption, circulation and proprioception. In clinical farriery, the frog serves not only as a functional component of the foot, but also as a vital reference structure for assessing balance, symmetry and internal alignment. Pathologies affecting the frog can significantly compromise hoof health and, by extension, the overall soundness of the horse. A detailed understanding of the frog's anatomy, physiology and pathology is therefore essential for both preventative and therapeutic farriery.
Anatomy of the frog.
The frog is a wedge-shaped rubbery structure located on the solar surface of the hoof, occupying the central and posterior portion between the bars and extending toward the heels. It is divided into several distinct anatomical regions, including the apex, the body, the central sulcus, and the collateral sulci. The apex is the most distal point of the frog and points toward the toe, while the base lies proximally between the heels. The central sulcus runs longitudinally along the midline of the frog and separates the two frog crura, which are the raised lateral portions that blend into the bars of the hoof. The frog is composed primarily of keratinized epidermal tissue that is softer and more elastic than the surrounding sole and wall. This elasticity allows it to deform under load and return to its original shape once the load is removed. Beneath the external horn lies the frog corium, a richly vascular and innervated dermal structure responsible for producing the frog horn. The frog is closely associated with deeper structures such as the digital cushion and the lateral cartilages, forming part of a complex biomechanical unit that dissipates forces during a locomotion. The frog's surface is often covered in a thin layer of exfoliating horn, which can vary depending on environmental conditions and hoof care practices. In a healthy foot, the frog should appear broad, well developed, and free from deep fissures or infection. Its texture should be resilient, rather than excessively soft or necrotic.
The frog corium.
The frog corium is the living tissue underlying the keratinized frog horn. It plays a critical role in both the production and maintenance of the frog. Structurally, the corium is composed of a dense network of connective tissue, blood vessels and nerve endings. This rich vascular supply contributes to the frog's role in circulatory dynamics within the hoof, while the innervation provides sensory feedback essential for proprioception. The frog corium is continuous with the corium of adjacent structures, including the sole and the bars, forming an integrated system that responds to mechanical stimuli. When the frog is loaded during weight bearing, compression of the corium facilitates blood movement within the hoof capsule, assisting in venous return. This mechanism is often referred to as part of the hoof pump. Damage to the frog corium, whether through excessive trimming, infection or trauma, can have significant consequences. Exposure of the corium results in pain, bleeding and an increased risk of infection. Furthermore, disruption of the corium can impair the production of healthy frog horn, leading to long-term structural deficiencies.
Function of the frog.
The frog serves multiple essential functions within the equine hoof. One of its primary roles is shock absorption. During locomotion, the frog deforms under load, dissipating forces that would otherwise be transmitted to more rigid structures such as the hoof wall and bones. This capacity for deformation is closely linked to the elasticity of the frog horn and the underlying digital cushion. Another critical function of the frog is its contribution to circulation. As the horse bears weight, the frog compresses against the ground, exerting pressure on the digital cushion and the venous plexuses within the hoof. This action helps to pump blood back up the limb, supporting overall vascular function. The frog also plays a significant role in traction. Its textured surface provides grip, particularly on soft or uneven terrain. In addition, the frog contributes to proprioception, allowing the horse to sense the ground and adjust its gait accordingly. This sensory feedback is vital for maintaining balance and coordination. Finally, the frog helps to stabilise the hoof capsule. By engaging with the ground and supporting the heels, it assists in maintaining the structural integrity of the foot. A well-developed frog is therefore indicative of a healthy and functional hoof.
Correct frog trimming.
Proper trimming of the frog is a fundamental aspect of farriery. The objective is to maintain a healthy, functional frog without removing excessive material. Over-trimming can expose sensitive structures, compromise shock absorption, and predispose the foot to infection. Conversely, inadequate trimming can allow the accumulation of debris and necrotic tissue, creating an environment conducive to bacterial growth. In practice, trimming should focus on removing only loose, exfoliating horn, while preserving the bulk and integrity of the frog. The central and collateral sulci should be cleaned and opened sufficiently to prevent the trapping of dirt and moisture, but not deepened artificially. The frog should retain a broad ground contacting surface that allows it to fulfill its functional roles. Attention must also be paid to the balance of the hoof. The frog should be symmetrical and aligned with the central axis of the foot. Any deviations may indicate underlying conformational issues or imbalances that require correction elsewhere in the hoof.
Frog size in relation to hoof shape and conformation.
The size and development of the frog are closely linked to the overall shape and conformation of the hoof. In a well-balanced foot, the frog should be proportionate to the hoof capsule, occupying a significant portion of the solar surface. A large, well-developed frog is typically associated with good heel support, adequate loading, and healthy internal structures. In contrast, a small or contracted frog often indicates poor hoof conformation, such as narrow heels or underrun heels. These conditions can limit the frog's ability to engage with the ground, reducing its functional capacity and leading to further deterioration. Conformation of the limb also influences frog development. Horses with upright pasterns may exhibit different loading patterns compared to those with more sloping conformation, affecting frog wear and growth. Environmental factors such as footing and management practices further contribute to variations in frog size and quality.
Thrush.
Thrush is a common infectious condition of the frog, characterized by the presence of necrotic malodorous tissue, typically within the central and collateral sulci. It is caused by anaerobic bacteria that thrive in moist, dirty environments. Poor hygiene, inadequate hoof care, and prolonged exposure to wet conditions are major predisposing factors. Clinically, thrush presents as black, foul-smelling discharge and degradation of the froghorn. In severe cases, it can penetrate deeper tissues, causing pain and lameness. Effective treatment of thrush requires a systematic approach that addresses both the infection itself and the underlying predisposing factors. Simply applying topical agents without correcting the environment or hoof balance will result in recurrence. The cornerstone of treatment is thorough debridement. All necrotic undermined froghorn must be carefully removed to expose healthy oxygenated tissue. This is essential because the anaerobic bacteria responsible for thrush cannot survive in the presence of oxygen. However, debridement must be conservative enough to avoid damaging the frog corium, as excessive removal will delay healing and increase sensitivity. Once the frog has been properly debrided, the next step is the application of antimicrobial therapy. Proven treatments include iodine-based solutions such as povidone iodine, which provide broad-spectrum antimicrobial action while also helping to dry the affected area. Copper sulfate preparations remain widely used due to their strong antifungal and antibacterial properties, particularly in paste form, where they can be packed into the sulci. Commercial formulations combining copper sulfate with binding agents help maintain contact with the infected tissue for prolonged periods. More modern approaches often utilise chlorhexidine-based solutions which offer effective antimicrobial action with less tissue irritation compared to harsher chemicals. In deeper central sulcus infections, especially those associated with pain and lameness, it is beneficial to flush the sulcus with a dilute antiseptic solution and then pack it with medicated gauze to maintain cleanliness and prevent recontamination. Environmental management is equally important. Horses should be kept in dry, clean conditions with regular removal of manure and soiled bedding. Turning out on well-drained ground and avoiding prolonged exposure to wet, muddy environments significantly reduces reinfection rates. Daily hoof picking is essential to remove debris and allow inspection. In cases where thrush has caused significant structural damage to the frog, mechanical support may be required. This can include the use of frog support pads or impression material to encourage weight bearing through the frog and stimulate healthy regrowth. As the frog regenerates, regular reassessment and trimming are necessary to maintain an open, healthy structure.
Canker.
Canker is a more severe and less common condition affecting the frog and surrounding structures. It is characterised by abnormal proliferation of horn-producing tissue, resulting in a cauliflower-like appearance. The exact cause is not fully understood, but it is associated with chronic infection, poor hygiene, and compromised immune function. Unlike thrush, canker involves excessive tissue growth rather than necrosis. It can spread to the sole, bars, and even the hoof wall if left untreated. The condition is often accompanied by a foul odour and discharge, although it may not always cause significant lameness in the early stages. Canker presents a far more aggressive challenge and requires a coordinated farriery and veterinary approach. The primary objective is the complete removal of diseased tissue, as canker is characterised by uncontrolled proliferation of abnormal horn-producing cells. This often necessitates radical surgical debridement, sometimes performed under standing sedation or general anaesthesia, depending on the severity and extent of the lesion. All affected tissue must be excised back to healthy, bleeding corium. Incomplete removal will almost invariably lead to recurrence. Following debridement, hemorrhage is controlled and the exposed area is treated with topical agents designed to inhibit bacterial growth and suppress abnormal tissue proliferation. Historically, compounds containing metronidazole have been used to target anaerobic bacteria, while astringent agents such as zinc sulfate or copper sulfate help to dry and harden the tissue. Modern treatment protocols increasingly incorporate the use of antiseptic dressings combined with compression bandaging. The application of firm even pressure is critical in preventing the regrowth of the characteristic proliferative tissue. This is often achieved using layered bandaging systems that include medicated dressings, padding, and a rigid outer support. Foot stability is another key consideration. Therapeutic shoeing is frequently employed to offload affected areas while maintaining overall hoof function. This may involve the use of hospital plates, which allow for repeated access to the treated area without removing the shoe, thereby minimising disruption. Strict hygiene is essential throughout the treatment period. The horse must be housed in a clean, dry environment and dressings must be changed regularly under sterile conditions. Recovery can be prolonged, often taking several weeks to months, and requires consistent monitoring to detect any signs of recurrence at an early stage.
Sheared heels.
Sheared heels refer to a condition in which one heel bulb is displaced proximally relative to the other, resulting in asymmetry of the heel region. This imbalance can lead to distortion of the frog, often causing it to become compressed or deviated. The condition is typically associated with uneven loading, conformational defects, or improper trimming and shoeing. It can result in pain, lameness, and increased susceptibility to infection within the frog. Therapeutic shoeing options include bar shoes, which provide additional support to the heel region and reduce independent movement of the heel bulbs. Straight bar shoes or egg bar shoes are commonly used depending on the specific requirements of the case. In some instances, wedged shoes may be applied temporarily to alter the hoof angle and relieve strain on affected structures, although this must be carefully managed to avoid creating secondary issues. In addition to farriery interventions, addressing contributing factors such as limb conformation, gait abnormalities and workload is essential. Regular, consistent trimming intervals are critical to prevent recurrence. As the hoof begins to remodel, the frog should regain a more central and symmetrical position, indicating improved balance.
Atrophy of the frog.
Frog atrophy is characterised by a reduction in size and function of the frog, often accompanied by contraction of the heels. It is commonly seen in horses that are shod continuously without adequate frog contact with the ground, or in those kept on soft footing that limits natural wear and stimulation. An atrophied frog appears small, narrow and recessed within the hoof capsule. It is less capable of performing its functions, leading to reduced shock absorption and circulation. Frog atrophy is primarily a consequence of insufficient mechanical stimulation. Therefore, treatment focuses on reintroducing controlled loading to stimulate growth and restore function. One of the most effective strategies is to increase frog contact with the ground. In shod horses, this often requires modification of the shoeing protocol. Traditional shoeing that elevates the frog away from the ground should be reconsidered. Options include the use of frog support pads or the application of impression material on top of the frog to ensure consistent contact during weight bearing. These materials must be applied carefully to provide support without creating excessive pressure that could lead to discomfort. In suitable cases, transitioning the horse to barefoot management can yield significant improvements. Removing the shoe allows the frog to engage naturally with the ground, promoting increased blood flow and stimulation of the frog corium. However, this transition must be managed carefully, particularly in horses with thin soles or other pre-existing conditions. Environmental modification is another key component. Horses should be exposed to varied terrain, including firmer surfaces that encourage frog engagement. Soft, deep bedding and consistently wet conditions should be avoided as they reduce stimulation and contribute to further atrophy. Regular trimming is essential to maintain an open heel structure and prevent contraction. The bars and heels should be managed to allow the frog to expand and occupy its natural position within the hoof capsule. Over time, with consistent stimulation and appropriate management, the frog will increase in size, thickness and functionality. Nutritional support may also play a role in recovery. Ensuring adequate intake of key nutrients involved in keratin production, such as biotin, methionine and zinc, can support the growth of healthy frog horn. While nutrition alone will not resolve atrophy, it complements mechanical and environmental interventions.
Complications from puncture wounds of the frog.
Puncture wounds to the frog are a significant concern due to the proximity of vital structures such as the digital cushion, navicular bursa, and distal interphalangeal joint. Even seemingly minor wounds can result in serious complications if infection penetrates these structures. Clinical signs may include sudden lameness, heat, swelling and discharge. Immediate and thorough assessment is essential, often involving veterinary intervention and diagnostic imaging to determine the extent of the injury. Treatment depends on the depth and location of the wound. It typically involves cleaning and debriding the wound, establishing drainage and administering appropriate antimicrobial therapy. In severe cases, surgical intervention may be required. Ongoing monitoring and careful management are crucial to ensure successful recovery.
Conclusion.
The frog is a vital component of the equine hoof, contributing to shock absorption, circulation, traction and proprioception. Its health and integrity are essential for maintaining overall hoof function and soundness. A thorough understanding of a frog's anatomy, including the frog corium, allows farriers to make informed decisions regarding trimming and management. Correct trimming practices are fundamental in preserving the frog's structure and function, while its size and condition provide valuable insights into hoof conformation and balance. The frog also serves as an important external reference for assessing internal structures, reinforcing its significance in farriery. Pathologies affecting the frog, including thrush, canker, sheared heels, atrophy and puncture wounds, present significant challenges that require careful diagnosis and treatment. Effective management involves a combination of proper hoof care, environmental control, and where necessary, veterinary intervention. Ultimately, the frog should not be viewed as a passive structure, but as an active and dynamic component of the hoof. Its condition reflects the overall health of the foot and the effectiveness of farriery practices. By prioritising the care and preservation of the frog, farriers can contribute significantly to the well-being and performance of the horse. If you would like to learn more about hoof care, then visit the farrier.co.uk, an educational platform created to deepen understanding of hoof health, farriery science, and equine soundness. This website brings together practical experience, academic insight, and real-world application designed for farriers, veterinarians, students, and horse owners who want to go beyond surface-level knowledge and truly understand how the hoof functions as part of the whole horse. Within the articles section of the farrier.co.uk, you will find a growing library of long-form educational content covering both foundational and advanced topics in farriery. These articles explore the structure and function of the hoof wall, sole, frog, and internal anatomy, explaining how each component contributes to load bearing, shock absorption, and movement. More advanced articles examine balance, limb alignment, hoof pastern axis, and the biomechanical consequences of trimming and shoeing decisions over time. There is also a strong focus on pathology and prevention. Topics such as laminitis, lameness, and poor performance are discussed from a farriery perspective, placing hoof care within the wider context of systemic health, management, and veterinary collaboration. These articles are written to encourage critical thinking, helping readers understand not just what to do, but why they are doing it. At the heart of the farrier.co.uk is the Hoof Care Companion, a comprehensive hardback book authored by Mark Jerram. This book is designed as a long-term reference rather than a quick read. It brings together decades of professional experience, detailed explanations, and high-quality imagery to guide readers through hoof anatomy, balance, pathology, and practical decision-making. Whether you are a professional or a committed horse owner, this book is intended to build confidence, understanding, and consistency in hoof care. In addition to education, the farrier.co.uk offers professional consultation services. These consultations provide in-depth assessment of hoof balance, movement, and long-term soundness using modern gait analysis and measurement tools. Consultations can be used to support rehabilitation cases, performance horses, or those with ongoing soundness concerns, offering clear guidance and objective monitoring over time. Whether you're here to learn, to refine your skills, or to seek professional insight for your horse, the farrier.co.uk exists to support informed decisions, better outcomes, and healthier hooves for the long term. Thank you for listening to the Hoof Care Companion. Please follow, rate and share this podcast on your social media to help the Hoof Care Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.